My name is Gregg Bush. I'm a service line specialist, registered nurse at the University of Missouri Hospital. I chose this career path because I never wanted to stop focusing on patients. I wanted to be an advocate for people during sometimes the worst day of their lives, sometimes the best day of their life. I have 2 college degrees. I have a Bachelor of Fine Arts, and I also have a Bachelor's of Nursing through the accelerated program as part of the University of Missouri Healthcare. The day-to-day duties, there's never a normal day where I work. Mostly what I do is I help administrate the unit with respect to the manager. I train new nurses. I get to check in on all the patients and see how well they're doing, how well my staff is doing. And if they have problems, I get to address those and help them have a better day than hopefully they started out with. They started out their day, every day, in a hospital. So they're not necessarily having a very good day. My job is to make their day better, help them get to the place where they want to be, which is home. I deal with lots of different parts of the hospital. Lots of different people come to me with questions about our service line, the internal medicine service line. I help them. I help families. I help patients. I help my staff, making sure that they produce the best possible outcomes for the patient. The best part of my job is helping to interpret the physicians to the patients. Physicians are very busy and they don't always have the time to address every tiny specific thing that patients or their families have. With my job, I'm able to help interpret what physicians say and bring it down to an individual level and really work with patients and their families, because we know that illness doesn't just affect a person, it affects a family. I think this is a tremendous career path for anybody for what they want to do. In fact, after I would get a Bachelor of Nursing degree or something along those lines, I think it's fine to go on for a master's. But after you get your Bachelor's of Nursing and you become a registered nurse, I would recommend going and finding out a little bit more about who you are. Because when you find out about who you are, then you can really make those connections with patients.